Hey everybody, welcome to Dental Voice Season 2 with Zyris. My name is Rolando Mia, and I'm here with Dr. Emilie McClellan. Now, the purpose of Dental Voice is to give us an opportunity to hear directly from clinicians and the experiences they're having. Because we had a discussion, oh my goodness, a million years ago, 5 months ago, with Dr. Emilie, just as we were coming in. I'm especially excited to hear how it's going and have her share with us. I think that's Dr. Emilie. Share with us what's going on. Good afternoon. This is the end of your day. How are you doing?
Hi, Ro. I'm good. I'm so comfortable. I've been wearing the ski suit or the scuba gear now for 5 months, and things are great. Great. Yeah.
All right. So, are you done for the day?
I'm done for the day. Yes, we just saw the last patient out about 30 minutes ago, and we are done for the day, and staff's cleaned up and gone home.
So, could you explain to me everything that you have on, and
Yeah.
then you can take it off, and how this is helping? Go ahead.
Sure. Well, I just see kids. And so, seeing kids dressed like this as opposed to, 6 months ago has been a little different. So when our little kiddos come in, I try to explain what I'm doing, and they're pretty familiar with gloves, but I say, I'm wearing gloves today because I want to be sure I have really clean hands when I look at your teeth. So, they understand that pretty well. And then I say, and I have this weird hat on. See this weird hat I have? And I said, I wear this so that I don't, I just say that way I can see your beautiful face, and that way I don't have any germs coming from me. And so that is that part. And then, they're pretty used to seeing me in my loops, but, I wear those usually all the time. And most kids are used to seeing a mask now, but to go, just see them right away with the mask on, most kids are wearing masks in anyway, but they kind of get that. And they pretty much understand that by saying, the reason I'm wearing my mask is because, well, first of all, my favorite color is pink. No, but I say because, we have the virus now, so be really careful. And so most kids understand that as well. I think the thing we always have to remember, though, is that, these kids may not be able to read our mouths or make sure we're speaking clearly so they can hear us underneath everything. And then when I say, yeah, and I have this big robe on, so make sure my clothes are clean when I go home to my kids. And so they kind of like, why are you wearing that big nightgown? I'm like, well, because every size that is my size is out of stock now. But it's hard to find things. But yeah, so that's kind of how we explain why we're dressed the way we are to our little patients.
Oh, that is so cool. Oh, there you are.
I'm
Welcome.
here.
So how do you explain, or do you also take time or with regard to the parents and all that type of stuff? How is that going?
I think most parents kind of get it. We walk out to the vehicle with a therapy dog, and we're dressed that way. And so we also had our video before we went back, and the parents dressed like that. So most parents haven't asked, or they're kind of used to it, but they kind of appreciate all the extra precautions we're taking. So that's good.
That's so cool. When we've last talked, it had literally you'd only just started seeing patients for just a couple of days, so it was absolutely new, and you had done all the preparation and you'd done all of the planning and you put things together. You mentioned that you talked to your team. Did every one of your teammates come back after the break, and are they still with you?
They all came back. They all came back very enthusiastically and ready to go. I even hired 2 additional people. So our team has grown and has been wonderful. Yeah.
Oh, that's so cool. There's been a lot of talk about the teams feeling uncomfortable about coming back and the exposure and the potential for infection. Are you sensing any kind of even a little bit of anxiety around that anymore, or is it?
No, not anymore. I mean, I think we look at the numbers. There hasn't been a lot of COVID cases coming out of dental offices. We know how to do infection control. We're trained in that. Like our staff's trained in that, and we just added a couple more layers. And I think we're so confident in what we're doing. We're so confident in how we do it. We haven't had a single COVID case here, but we're so thankful for that. And so, no, my staff coming back, yes, there's all the talk, dental's dangerous. Oh my gosh, 4 of top 5 jobs are hazard dental. And we were a little nervous, but gosh, we're not anymore. We're just thrilled that we're working again and thrilled to see our kiddos again. So it's been good.
So okay, share with me, what's the experience of your kids coming back? What is it? What are some of the things that they're sharing with you? What are some of the comments that they're giving you about it and everything? What's that all like?
Well, I think the biggest thing they're disappointed in is that they don't get to play the toys and the games anymore because we have, no more waiting room. We put the toys away, the games away. And so it's a lot more of, we're just going to visit and chat and maybe watch a movie that's on the TV, above them. And so that's kind of been one thing that they have kind of missed. A lot of kids also miss their friends, and they'll talk about missing their friends because they can't see their friends or go on vacations, things of that nature. But overall, like, kids are happy to be out and about a little bit, I think, getting out of the house.
Now, do you get the sense that the children recognize or have the same kind of, whatever fear I'm going to use of being infected that adults have? Or are they kind of do they not really understand what's going on with regard to everything that, in the world today? What's your experience with them around that?
I would say, like, our practice is generally focused on pretty young kids, like 8 and under. And so I would say most of our kids don't really have those anxieties. A few teens that we've seen have had those anxieties and concerns and have asked, certain questions like making sure we have a mask and wash our hands. But for the most part, I think kids are just so easygoing. They just kind of go with the flow. They're like, okay, I have to wear a mask. Okay, I don't get to get the treasure chest. They just kind of go with it. And I was kind of nervous coming back if kids were going to be scared of us and all that get up. And kids are just so awesome. They just roll with it. I wish us adults could be more like that. But yeah, they have been good. Yeah.
And no issue. Oh, that's so cool. So the process, how have they been with regard to the, having to wait outside, and what's the reaction to having your therapy? What's your therapy dog's name?
Cal.
Oh, Cal. I thought you said,
yeah.
I thought you said cow.
No, it's Cal, like California, but yeah.
Oh.
Yeah, he's hanging out. He's tired.
Oh yeah. How do they like that experience with Cal?
Oh, they love it. They love it. And we kind of try to make it fun with, like, drawing hopscotch on the sidewalks as kids can come in, doing things like that. But it hasn't been too bad with a little bit of changes there, waiting outside or waiting with mom and dad in the car for a minute. And we try to just be really efficient and timely in our appointments, get them in and get them out on time. So there's not a whole lot of waiting that can, kind of increase that anxiety and stuff.
So that's cool. And, I love the fact that the kids haven't been freaked out. Your entire team is back. You've even added a couple of members so you can serve and take care of folks that you're taking so much care. Let me ask you this. Are you experiencing there's been a lot of talk about how, because people, kids, adults haven't been back to the dentist for so long, oral health is starting to become an issue. Are you seeing that with the kids and with regard to things like decay and just compromise?
Oh, yes. Have we? It's kind of funny. This one teenager we have, we're like, dude, why didn't you brush your teeth? He's like, I have to wear a mask anyway, And I'm like, oh my gosh. No. So yeah, we have seen probably more poor oral hygiene habits. I think also not being in a routine with school and things like that. Kids are kind of falling out of routine and parents have fallen out of routine. Plus snacks are kind of more frequent maybe at home than they would be if we were in routine or at school. Maybe a little bit. Rolando, is that you? Are you snacking more at home?
I go through a 5-pound bag of trail mix in like 3 days. It's so horrible.
Oh, I know, right? And it's but in all truth, like, our decay rate has really gone up. We're also a military community, and so we get a lot of kids that move in, and a lot of kids were maybe slated or had scheduled appointments where they were going to be, and then those got canceled. Now they're moving here and having a hard time getting in. And so we've even seen a few new patients this week that haven't been seen in quite a while and were supposed to get treatment, but then moved and couldn't get into an office, and so our decay rate's really high right now. The oral hygiene is, But we really want to encourage people, get in the dentist, like make sure that your kids are healthy, make sure that they're brushing their teeth. Let's keep those snacks at bay, and don't be afraid to come. Like, we're here, we're ready, we have all the precautions set. We want to make sure that your kids' teeth are healthy.
Oh, wow. That's amazing. And you think about it, with the adults, the added stress, clenching, cracked teeth. We've heard about that, having to wear the mask, the questions about working and all that. And then, it kind of translates. It's interesting that it's translating down to kids. So I think, oral hygiene. Have you, when we last talked, probably the biggest, and it continues to be a pretty huge issue, is this, the transmission of this disease of COVID, and that, it's definitely in aerosols, or definite people are saying that is. How are you dealing? We were talking about HVAC systems, vacuum, all that. How is it with aerosols with you?
Well, we're doing the social distancing, of course. Keeping the kids. We use the IsoDry or the Isolite on just about every single procedure. I mean, it's not even a question. We put it in, and then we also have the HVAC with it. So I feel like we're doing everything. Everything we can. So we even take our IsoDry to the OR, which is really fun and very helpful. And it's been a great tool for us during this time. Yeah, for sure.
What kind of additional procedures with regard to surfaces have you put in place? What does that look like for your practice now?
Yes. So, we don't set up early anymore. We didn't do that whole lot anyway before, but definitely minimizing as much extra stuff around as possible. Like we used to have, our books and cute things around, and now obviously we've taken those down. We wipe and let things stay wet for a little longer than before. And, of course, have the Cavicide and all those things. And just taking a couple extra minutes between patients is just worth it, I think, for our, peace of mind and whatnot. So, yeah.
Wow. And as far as, and you kind of mentioned it, what is the experience that your team is having all the extra garb and the face mask and the shield and having to all that? What's their experience around that?
Can I say that we're pretty happy it's fall, that summer's ending here. So we go out to the vehicle to meet the parent and the child, and so the girls are coming in and out all day, and our electric bill is really high this summer. Trying to keep things cool in here and keep the staff somewhat happy. It's one of those things, like, it's exhausting. We don't like it, but we know we have to do it, and we're just going to do it and keep a happy face about it. So, yeah.
So it's really comfortable. I think that's what you said when we first got on, right?
Mm-hmm. Yeah.
Oh, wow. So I'm curious. There's been a lot of discussion. There's been a lot of talk. Just a recent live stream that we had with Dr. Mark Hyman, he mentioned that there was a study putting out that practices are opening, which is a good thing, but the number of patients has decreased, or actually heard that there are some practices out there that haven't opened up at all. Are you seeing that? Are you experiencing any of that with yours or in your area?
I have not seen that in my local area. No, we're pretty small. We're pretty small, our community, about 50,000 people, and all offices have reopened. I would say most of us are doing well. We haven't seen that here. Thankfully, no. So. And
how's your practice doing? Are you seeing your patients come back? Are you seeing the level of engagement that you had prior to all of this?
Well, we had a very busy summer with just rescheduling people and getting kids in before school. We added more hours because we couldn't see as many at once. And so we had good numbers, but now we're coming up to that 6 month from when we were all closed, with quarantine. And so now I'm looking at my end of September, October schedule, and things are a little lean. So we kind of knew that coming in, that there weren't appointments being made for those 6 month recalls back then. And so we've tried to get a little bit creative with our scheduling to kind of make sure the numbers are staying up. We are encouraging patients to call new patients that are in town, running some Facebook ads and campaigns saying, hey, come in, let's get your teeth checked. Let's get these kids' teeth checked. So we had a great summer, but we're starting to kind of go down a little bit here in the next few weeks.
Oh, wow. So it looks like, do you think it's because people are still kind of staying away because they're trying to hedge bets with regard to whether they should go or not? Or do you think that it's just it's a function of kind of everything that's going on?
I think it's both. I think school starting, I think there's more like, oh my gosh, we're going to be exposed more because some kids are going to school, some kids aren't. There's colleges are starting up. We're in a college town. There's more, I think people are being a little more careful about how much going out they're doing, just because of all those extra activities that are going around. And then, you know, I think dental is one of those things that's kind of like you kind of forget about, you know, with everything else. So just really want to encourage our families to be sure you're getting those teeth checked, those kiddos, and getting them all ready to go, you know, for school and whatnot.
Yeah, well, I regardless of everything, I love the fact that through this all, you've always maintained such a positive attitude. There's an energy to you, which is just pretty cool. And I mean, how's that? How are you feeling about it? Are you hanging tough there? I mean,
there are days that I'm not so tough, but for the most part, we're okay. You know, I think you try to look at life, and you're like, man, that was really hard being closed. And I was so happy to be open, and I'm looking ahead and like, geez, we're not very busy. Are we going to, you know, you kind of get these fears, and you're like, but you know what? I'm going to look at the bright side. Here's some more time I can spend with my kids, or here's some more time I can work on in my website or getting staff training, or try to look at it and not get too down on myself. I think we're all kind of getting sick of being at home and being not traveling and those kinds of things. And, you know, I think everybody's getting a little weary. But just trying to maintain some bright spots here and there is so important for everyone.
And how's the connection with your team? Last time we spoke, it was the message you gave. They're incredible. How's that going?
Our team is good. They're such good friends. My girls go out a lot, and you know, with not being able to see family and friends, that they've kind of become their own family. We all kind of have our own family now, and so even on weekends, we'll spend some time together, maybe doing a barbecue or something because we feel comfortable being together. And so our team is really strong, and they're great. Like, they're goofballs. I love these girls.
Goofballs?
They're just goofballs. They know it. Yeah, but it's been good. The team camaraderie is really good. I think we try to make sure that we have fun amidst all this stress, that we are having fun. We are laughing. If something gets stressful at work, one of the girls will start singing a song, like, you know, just, okay, here we go. Like, let's just be happy, you know, clap your hands, and we all want to glare at her, like, you know.
Like, wait a minute, where are you from?
Yeah.
Well, you shared with me that one of your teammates is now has a foster child. His name is Declan, isn't it?
Yes.
How's he doing? God bless.
He's awesome. I let my staff bring their babies to work until they can start crawling. And so we kind of always have a baby around, because everyone that, as most practice owners will know, once you hire an assistant or a great front desk girl, they get pregnant, right? Every time. I mean, that's what happens. So we always have a lot of times have a baby here. And one of my girls worked so hard to become a foster mom. I mean, she just worked her tail off for 6-7 months and finally got her license. We had a huge barbecue for her. Yay, she got her license, and she kept waiting and waiting and waiting and waiting for it to get matched. And a couple weeks ago, our one little baby that was here was going to daycare. We're like, oh, the baby's leaving, you know. And then 2 days later, she gets a call that she's got an infant that matched with her that's just a week old. And so we are so blessed. We have a little baby at the office again, and he's just tiny, a couple weeks old, and it's just been so much fun to have another one around.
Oh my goodness. And you know what's so cool too is, well, first of all, that, you know, it's okay to have your team bring their babies to work. And
yeah, absolutely.
But also the context of safety, and that you feel comfortable enough that you're willing to bring your baby in, and you know, the fact that you haven't seen infection and you're taking all the protocols. I mean, was that ever an issue when you were thinking about that?
No, we kind of have rules, like nobody holds the baby with, remember all the stuff I had on? No one holds the baby with that stuff on. And the baby's things are, in a separate area by the girls at the front desk, and they're surrounded by the plexiglass, and so we get to hold baby before patients and after we change. So us in the back don't get to hold baby as often as the girls that are answering the phone or at the front. But yeah, we're just careful, and there hasn't been any issues. We've been really blessed, and it's just been awesome.
Oh, that is so. It makes me feel so. I mean, it's holy cow. That's what is it? People don't care how much you know until they know how much you care, and it's
Right.
pretty cool. I mean, that's so awesome. It's just
Yeah.
from a personal perspective and all that. How do you see if I were to ask you, because one of the things that everyone is looking at is the future of this and how to navigate that. What are some of the things that you're personally putting in place to kind of get you through that, and what are things that you're considering with regard to moving forward and all that?
Yeah, I think one thing I kind of wonder is, how long do we do the social distance and the mask and having our waiting room closed and no toys and those kinds of things? I guess time will tell. Patience is, they say, this virtue that I'm, it's just hard, Rolando. I think all of us, so many of us are just getting tired and frustrated. We miss our friends, miss our families. We want to travel. We want to do things. And it's just not as easy as it was. And so I know I personally struggle a little bit. So taking walks is good, exercising, trying to eat right, doing Zoom calls with friends like you, or, family that's not here. Just trying to encourage those around us too. It's hard. And there are days that you just get mad and you get frustrated. It's hard. I'm not, fighting that.
What advice would you give people, in addition to that, what advice would you give people who don't have those kinds of things or are really, really, really struggling right now? What would you tell those folks?
Probably, reach out to someone and talk. Don't stay isolated. You need these things, these fears and things need to be talked about. And there's options for that, with mental health providers or your physician or whomever, a friend. Be sure you're reaching out. Be sure you're talking to people. I know that even, I have a lot of great friends here, physicians and optometrists and just great girlfriends. And we'll just go to the pool, or we'll just sit together and we'll just hash it out like, and you just get angry. You're like, this is stupid COVID, and you're just mad. And then you feel better. You're like, okay, I got that off my chest. Now I can go home and be a mom or whatever I need to do. And so I think just talking to your friends and just getting through it, it's going to be okay. We're going to get there. We're going to get there. We're resilient. We'll get there and it'll be okay someday.
Oh, that's cool. And you have 2 kids too. How are they experiencing? What's their experience through all of this with you, working and going through that and everything? How's that going?
They're so awesome. My kids are amazing. They got to stay home all summer with a nanny. I'm really fortunate that I could do that. They go to private school, so they're in school now. And they kind of say, Mom, why can't we go to the pool, or why can't we do this or that? And they say, oh, because of the virus, and like, yeah, we can't do some of those fun things that we used to do, but they're hanging in there. They miss their friends and their family that's not close. But we try to just keep things as fun as we can at home. And little kids, they just take it, I guess,
They just they get it and they feel it and they say, we're going to go. So what have you changed in your practice? What has anything really dramatically changed other than the increase in cleaning up and all that type of stuff?
Well, we used to isolate and dry a ton more than we ever have. I think, we get a shipment almost weekly. I feel like that's been a huge change for us. And it's made dentistry a little faster too, honestly, because it's all stuffed up there and goes, and you have the bite block, the isolation, the retraction, the suction, the light. So dentistry is going a little faster there, and we're getting quick at it, And so that's changed. Not a whole lot else has really changed. I mean, really, we're starting to increase patient numbers per day again. I think we're getting a little more comfortable and getting quicker, and so we're doing that. But nothing else has really changed. No, still here.
Still there, still tracking through, still going. I'm happy to hear that your patients are coming. It's so wonderful to hear that your patients, they're not freaking out. Was there anything that you thought was going to happen that completely just didn't happen?
Minus us all getting really sick. I thought we'd all get COVID. I did.
Really?
I did. Well, when we first opened, they kept saying, the 4 of the top 5 most dangerous professions were all dentistry. And I was thinking, oh my gosh, we're in a college town. We treat military children. One of us or all of us, we're gonna get it. And I was just kind of taking like, okay, we're gonna get it. And so I thought that for sure would happen. And it hasn't. Yeah. I mean, it hasn't. We have been healthy. We've been careful. We haven't been reckless. We've been careful. We've been doing our due diligence. I also thought that kids would be scared of the mask and all that stuff I was wearing. I thought kids would be really scared, and I thought it'd be harder to treat and harder to make those relationships. But yeah, it hasn't been. It's been okay. I've been very pleased with that.
That's so. And I can imagine how. You're right. There was so much. Oh my goodness!
Oh yeah, it was terrible.
It was like, yeah, hey, if you're in dentistry, good luck, goodbye. And you're like, what?
I know. I thought we were going to have to close. I thought I was going to have to become a backup dancer for some, I don't know. It's just like, I don't know what's going to happen.
You're a dancer?
Well, I took ballet, and I've always kind of wanted to be like a backup dancer for a rock star. And so,
where did that come from? Oh.
I don't know. It's just my ornery side of me. I don't know.
my ornery side. I love it. Backup dance. Holy cow!
I want to be the front dancer, just somebody in the back.
Oh, okay. At some point here, we're going to be traveling again. We're going to be around. Yeah. I'm going to have to come out, and you're going to have to share with me this story about this backup dancing for a rock band. Maybe over a couple of libations. We'll see. But
okay. I'll show you my moves.
So, first of all, I so appreciate you taking the time. I mean, it's the end of your day. You're still there. Sure. I'm sure you're exhausted, and you've got so much going on. And I love the fact that things continue to go through. Like we did last time. If I were to ask you to sum up again the kind of the sentiment and what message would you like to give to your team, to your patients, to your community, to the folks around there who are listening to us around this, what is it that you'd like to let them know just about pretty much anything?
Well, I have to always start with my team because my staff is the best. Literally, they're the best. I love my girls, each and every one of them. They keep me going. They keep me positive. We keep each other going. Thank you, girls. You have no idea how much I love you, every single one of you. Thank you. For my community, hang in there, guys. I'm proud of our community. We have been strong through this. Just stick together. And for my patients, please come. We're doing everything we can to keep you guys safe. And we want to make sure your teeth are healthy and strong, and we're ready for you. And to my kiddos, I love you, Tylee and Tag. Thank you for being the best kids in the world. Mama loves you. Yeah.
Oh, that's so cool. Well, here's a couple things too. The good news, the fantastic news, because of the precautions that you put in place, because of the focus on safety, maintaining effective infection control protocols, effective guidance with regard to the way you are treating things in the practice. There are no cases in your practice. So we've heard, and it's becoming more and more evident, the dental practice is one of the safest places.
Right.
So
absolutely.
If people are even the slightest bit apprehensive about going back to the dentist, I would say don't be. And if you still are, call. So if people wanted to call and speak to you, what would be the best way to get in contact with you?
Probably just calling our phone number. It's 785-370-8004. And they can speak to, one of my beautiful girls, Rebecca or Amanda, and talk about that. But yeah, we're confident in our procedures. We're confident in what we're doing here to keep everyone safe. Yeah.
That's cool. And then also you've got your twostory.com site.
Yep.
And then, your face. I love the post that you have on your Facebook site. I was curious to see if you could put a mask on your therapy dog.
Oh, I'm sure he'll do it.
You think so?
Oh yeah, that dog. He'll do just about anything.
Oh, it would not be a therapy dog with a shield is coming out. Put a gown on him. That would be hilarious.
I'll do it. I'll do it. Good for you.
Oh, and then he's gonna be like, "What are you doing to me? Who made you do this?" Don't say my name. Don't say my name.
Dog. He has to get dressed up all the time. He's just like, "Oh, here we go again. What are these girls doing now?"
I love it. Well, hey, Dr. Emilie McClellan, first of all, I am grateful and just honored to know you. I really appreciate what you're doing there, how much you care about your patients and everything you're doing. I love the fact that you're willing to, at the end of your day, spend a little bit of time with us, share so directly around the things that you're dealing with. Hey, folks, if you have any questions for Dr. Emilie, please reach out to her or check out the Two Story website or Facebook page. If you like this content, please share it. If you have any questions, please let us know. You know what? Again, several months from now, when we're even more through this, would you be willing to come back and share with us how things are going? Maybe we might even do it in person. We'll see. I don't know.
Oh, that would be so fun.
That would be. Oh yeah, but except your Clay would be no. What's the name of your dog?
Cal.
Cal. I said Clay. Cal will be like, he's the one who made you put that stuff on.
Yeah.
So, but thank you for that. Please have a great evening. Please be safe, and if you would, please say hi to your kids for me and us, and please thank your entire team. I look forward to seeing them at some point here, and
yes,
you be good.
You're welcome back anytime.
Awesome. Thank you so much.
Thanks, Rolando. All right, bye.
Bye.